Hi, Alice.
Hi.
My name is Dr. Matt. How are you doing today?
I'm good.
Okay, perfect. Thanks for coming in. I see that you're in for a head-to-toe assessment. Can you please verify your last name
Smith.
and your date of birth?
7/5/2000.
Okay. Can I have your social security number?
123-456-789.
Perfect. All right, and your insurance is the same as last time? Okay, perfect. So let's go ahead into the medical history. Do you have any allergies?
No.
Are you taking any medications on a daily basis?
No.
Okay, any medical history of back problems?
A little bit. Yes.
How long has it been going?
About 4 years.
Okay. Any kidney problems?
No.
Have you noticed any irregularities?
No.
Any heart problems?
No.
Any heart disease in the family members?
No.
Okay. Were you ever diagnosed with a thyroid disorder?
No.
Do you wear contacts?
No.
When was your last dental checkup?
About 4 months ago.
Any surgeries?
No.
Okay. Looks like I have everything that I need. Just going to sanitize my hands and we'll start with vital signs. Have you noticed any flu-like symptoms in the last 48 hours?
No.
Okay. Any rashes that wouldn't go away?
No.
Are you experiencing any pins and needles in the legs or arms? Any headaches that wouldn't go away with Tylenol or ibuprofen? Just going to place this under your tongue. I'm going to have you hold it for me, please. Perfect. And then this will go on your index finger. It's going to measure your oxygenation. Perfect. Have you relax? Let's go on and check that. An 86.1 Fahrenheit. That's very normal. And we'll measure your blood pressure as well. So go on your upper arm. It's going to give your arm kind of like a squeeze. Do you have any arm restrictions, meaning that you cannot use one arm? Okay. I'm going to put the stethoscope right here in the crevice, right around the elbow. I'm going to have you relax now. Okay, blood pressure is a little bit low, 98 over 59. Do you feel dizzy, lightheaded?
No.
Okay. Let's go ahead and write this down in your file. So oxygenation is 98% on room air, heart rate a little bit elevated, 92. Blood pressure, we said it was 98 over 59. Asymptomatic. And the temperature was 96.1 Fahrenheit. Okay, I'm just going to take this from you. And I'm going to have you relax. I'll listen to your heart and your lungs. Is it okay if I put the stethoscope on your chest? Okay. Go ahead and take a deep breath in for me. And breathe out. And again. And breathe out. Okay. Now I'm going to have you breathe normal. We're just going to listen to your heart. I can hear only S1 and S2, no S3, no S4. Just going to listen under the belly too. Just move it to the left. Very good. Let's go ahead and check for any murmurs. Can you go ahead and take a deep breath and then hold it for 1, 2, 3. Breathe out. Okay. Hold it down one more time. Take a deep breath in and hold it. 1, 2, 3. Breathe out. Okay. Going to make some movements. I'm going to guide you slowly with your head. I want to see if there is any kind of pain or limitation in movement, okay? I'll have you relax. Okay. Let's go ahead and put some gloves on. Okay, we'll try that again. Okay, go ahead and relax. Bring it down. Try to touch your chest with your chin. Okay. Any neck pain with that? Alright, I'm gonna have you put your arms in front of you like this, and I'm gonna try to push them down. Don't let me do that, okay? Okay, a little bit of weakness, so try to hold them steady for me. Okay. I'm gonna try to open them. Good. Okay. Okay. Very good. Alright. Can you go ahead and squeeze my fingers? Okay. That was good. Alright. I'm gonna have you lay down and we're gonna start with a scalp examination. Okay, Alice, I'm just going to start by palpating your TMJ. And slowly I'm gonna have you open your mouth as wide as you can. Okay, one clicking sound on the left side. You can go ahead and slowly close. Let's do that one more time, and when you close it, I'm gonna have you do that slowly as well, okay? One more time. And close. Okay, left side. We're gonna send you for an MRI to check placement. We're checking for any lymph node enlargement. Here we have submental. Preauricular lymph nodes and postauricular. Moving down to the neckline, just going to slowly test here above the collarbone as well. This is perfect position because it allows me to really feel checking for any lumps or bumps on the forehead. And here we have the first set of sinuses right above the eyebrow level. And just slowly going to palpate under the eyes. This is where we have the second set. And usually if you were having some pain or discomfort when pressing down, that would indicate some sort of infection, but it does seem to be normal. Checking the eye level to see if there is anything concerning. Face does look symmetric, but I would like to take some measurements here. And if you don't mind, I'm gonna have you slowly raise your head up a little bit, bring it back down. And we're checking head circumference. We're going to put this down in your file. Okay, go ahead and relax again. Perfect. check your ears. So we're looking for any abnormal discharge, see if there are kinds of infection. Alright, I'm gonna have you turn your head towards the right shoulder. Perfect. And I'm going to slowly elevate the tragus. I am seeing a little bit of redness. Do you use a cotton swab to clean your ears?
Sometimes, yes.
Okay. Try not to go too deep in the ear canal, okay? Alright. Just a little bit of earwax on this side, but it doesn't seem to be inflamed. Okay, let's go ahead and place this down here. I'm gonna have you cover your right eye and keep your eyes open for this test. Okay. Can you go ahead and grasp this with your other hand? Okay, and extend your arm all the way. Perfect. Now, can you read the last row for me?
LTFPH.
Okay, and what color do you see right there? On the left.
Red.
And on the right?
Green.
Okay, go ahead and switch eyes for me. And now try to read the last row, starting with the first letter to the right.
HPFTL.
Okay, very good. And what color do you see on the right?
Green.
And on the left?
Red.
And the red, is that the same intensity as the left eye?
Yes.
Okay. I'm gonna take that. Okay, we're gonna go ahead and do a scalp exam, starting with some general inspection with a hairline. I'm going to run a few tests because I do see here a little bit of swelling. Can you go ahead and tell me if you feel this cold or warm? Okay. What about now?
Warm.
Cold. you tell me if this feels sharp or dull?
Dull.
And now?
Sharp. Sharp.
And does this feel cold?
Yes.
Okay. Perfect. Can you go ahead and tell me how many taps you feel this?
2.
And now?
2.
Okay. Does this feel cold?
Yes. Yes. Yes.
And does this feel sharp all the way?
Yes.
Does this feel cold?
No.
Okay. What about now?
No.
And now?
No.
Okay. I'm going to go ahead and take some measurements. Of this line right here. Okay. It does look like we have enough to grab a sample. Okay, so we're going to send that to the lab. Looking for any signs of folliculitis. Just go ahead and turn your head a little bit more. That's good. Any neck pain with that? Okay, I'll do the same thing on the other side. Go ahead and turn your head to the right. Good. Any neck pain with that? Lastly, what I'm going to do is to just slowly palpate the entire skull with the tip of my fingers. This will allow me to check for any parts that I did not have a chance to look at. Also, I'm checking for asymmetry. Very good. All right. Now I'm going to move to the lower part of your body, so we're going to check your abdomen. Would it be okay if we unbutton the pants just a little bit so that we can see maybe this part?
Yeah.
Okay.
Should I unbutton or just pull it down?
Whatever is.
Because they're pretty loose.
Okay, I think that should work. Perfect. Now we're going to do an abdominal examination. I'm going to go ahead and lift the shirt a little bit higher so that we can take a look at the ribs too. Okay, that's perfect. Relax. Okay. I'm going to start by listening. That's good. I'm going to percuss. Let me know if you feel any kind of pain. Are you experiencing any abdominal discomfort? No. Okay. Now gently I'm going to palpate. Let me know if you feel any pain. We're looking for any distension, tenderness, rigid abdomen. Something that would indicate maybe internal bleeding or anything swollen. Also checking the normal size of main organs. Okay, now that I did a light palpation, I'm going to do a more deeper one. Let me know if you feel any kind of pain. A little bit of tightness there. Okay. I can't feel the liver, which means it's a normal size under the rib cage. A little bit of rigidity here in the middle. Okay. Checking kidneys, so I'm going to slide my hand a little bit under your back here. Relax. Good. Relax. Okay. All right. And on the same thing on the other side. Relax. Okay. Very good. All right. I'm gonna go ahead and check your back now. So I'll have you turn on your tummy and we'll examine the spine. I'm going to go ahead and open the gown in the back so we can take a look at the spine. Okay, I do see here that you have some circles on your back. It looks like you just recently had cupping therapy, is that correct?
Yes.
Okay. Any pain when I'm pressing down?
No.
Okay. Right now I'm going to measure your whole spine, starting with the cervical. And your shoulders. Okay, that looks normal. You're checking for any nerve damage. Go ahead and say 99 for me.
What is it?
99.
99.
Okay. One more time.
99.
Good. Go ahead and tell me when you don't hear, when you don't feel the vibration anymore.
No. No. No.
Okay. I'm going to test your sensations as well. First, I'm going to touch you with a sharp object. This is what sharp is going to feel like. And the other one is going to be dull. This is what dull is going to feel like. Go ahead and tell me if you feel sharp or dull.
Sharp. 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 Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay, good.
Dull. Dull. Sharp. Sharp.
Good.
Sharp. Dull. 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 Sharp. Sharp.
Okay, now go ahead and tell me if this feels cold or warm.
Cold. Cold. Warm. Cold. Cold. Cold.
But I'm going to check the skin as well, see if there's any elevations, something that would cause some sort of concern. And if we do, we're just going to send you to dermatology. checking the level of hydration. Okay. Go ahead and take a deep breath in for me. And exhale. And again, take a deep breath in. And exhale. One more time. Breathe in. Breathe out. Okay. Okay, let's go ahead and check your legs. We're looking at placement here. I am noticing right foot going inward. Okay. I'm going to go ahead and clean in between the toes. There's a little bit of dry skin, and this usually helps to moisturize the skin really well. Okay, that should be enough product there. Okay. We're going to check Babinski reflex. Good. Good. Okay. Pedal pulses are 2+, symmetric. Checking for any pedal edema. Any pain when I'm pressing down? Check for inflammation. So we need to see if there's any sort of asymmetry. Okay, we're looking for scratches, eczema, see here some discoloration. Do you know how long you've been having this?
About 10 years.
Okay, and has it changed in appearance or has it stayed the same?
Stayed the same.
Okay, that's usually a good indication that there's nothing to be concerned of. Everything is benign. Okay. Everything looks symmetric here. Beta pulses are normal. What I'm going to have you do is I'll have you sit back on the table and we're going to check your reflexes. Okay, go ahead and relax your foot for me. Okay. 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 I would say diminish reflexes. Okay, let's try that one more time here. Okay, that's good. So go ahead and relax your arms. Good. Okay, just let it loose. I can take all the weight. Okay. Okay. Relax. Okay, perfect. Okay, Alice. So I'm gonna go ahead and send you to the lab. It's right across the room from here. They're going to do a full panel, so I'm going to give you a call back whenever I have the results. Usually it takes about 48 hours to get them back. And if you don't hear from me by then, you can go ahead and give us a call and we'll definitely answer any of your questions. Do you have any questions for me right now? Okay. So we're gonna go ahead and sign the lab work. Good. And whenever you're ready, I'm gonna have you go to the lab and that's it. Thank you for coming. I'm going to start by palpating your face. I'm looking for lymphadenopathy. I'm looking for lymph node enlargement. Anything that would indicate an infection inside the body. Palpating preauricular lymph nodes. Postauricular lymph nodes. Occipital. Checking sinuses right under the eye socket. Looking for tenderness, changes in skin temperature. and palpating sinuses above the eyebrows. Not feeling any elevation. Going to check for skin lesions, mainly on the face. Going to check hair distribution on both eyebrows. Moving down to the eye area, just going to check eyelashes, making sure that we are not seeing any cysts, signs of infection. Moving that hair growth pattern. Very little face indentation. I'm not seeing any hair growth, which would be an indication of a hormonal imbalance. Going to take a few measurements, looking for any asymmetry, which would indicate inflammation. slight change in degrees expected. You're looking for measurements higher than 2%. I'm going to take a sample. I did see a couple of lesions. I'm going to take a sample. Going to check reflexes. Go ahead and relax your jaw for me. A little bit more. Good. Okay. Go ahead and tell me how many taps you feel.
2, 2, 1, 2.
Okay. Can you tell me if this feels cold or warm?
Cold, cold, cold. 1, cold, cold, cold. Warm, warm, warm.
I'm going to touch it with two textures. One is going to feel sharp. It has, the object has some sharp indentations. They do not poke the skin, so it will not penetrate, but you will definitely feel that kind of painful stimulus. And then I have a dull object. It's going to feel something like this, very fluffy on the skin and barely touching. Go ahead and tell me if you feel sharp or dull.
Sharp, dull, dull, dull. Sharp,
That was very good. We're gonna go ahead and start working on your scalp as well. So we're going to do a very thorough skin assessment and check how the pattern looks, okay? I'm going to go ahead and take a look at the hairline. Starting with behind the ear area. Looking for any skin lesions. Not seeing any redness, but there are two spots, just a little bit more colored. They're very tiny. Did you wear anything tight around the neck or the scalp area?
I had a wig on, and I think the clips from it might have caused some trauma to the surface of my
Okay,
skin.
that's good to know. Okay, I'm going to run a few tests. I'm going to check to see if there is any abnormality. The scalp looks normal. Can you go ahead and tell me if this feels cold or warm?
Cool. Warm. Cold. Warm. Warm.
And does this feel sharp or dull? Can you please tell me if this feels sharp all the way?
Yes.
Okay. My scalp looks a little bit red on this side. So what I'm gonna do is I will take a sample, but first I need to prepare the side. So we're trying to lower the acidity of the scalp so that when we collect a sample of the skin, it'll be ready. This spray doesn't damage the scalp nor the hair follicle. I'm going to first go ahead and distribute it evenly. This should feel just a little bit ticklish and very gentle on the skin. I'm going to go ahead and collect the sample, send it to the lab. I like to check the sensitivity of the scalp here just to make sure that the spray we applied functioned properly. Can you please tell me if this feels cold or warm? Cold or warm?
Cool.
Okay. Does this feel sharp or dull? Okay, now I'll do all four in different order. I'm just gonna need you to tell me if it's cold, warm, sharp, or dull, okay?
Cool.
go ahead and tell me if this feels warm or cold to you. Does this feel dull? Does this feel dull? What about now? And now? Okay, is this warm? And is this warm? Okay, we're gonna go ahead and do a scalp treatment. We're going to start with a lymph massage that starts at the base of the skull and goes in the same direction as the blood pumping through the brain, and around the scalp area. This helps to remove toxins, elevate pH levels, I'm going to apply an anti-inflammatory oil. I'm just warming it up between my palms. This is going to go at the base of the skull, behind the ear, helps to reduce swelling. It helps to reduce swelling. I'm applying gentle pressure. This usually helps to alleviate any tension that has accumulated in the muscles. going to apply acupressure therapy on the spots that we saw a little bit of inflammation and swelling. Working on the hairline as well to reduce some of the stress. I'm going to apply pressure therapy. going to go ahead and perform hair pulling therapy as well. This helps to release some of that tension that is accumulated under the fascia. We're going to start with small strands of hair and just releasing the tension by pulling on the hair. Mainly focusing on the hairline. Hi, Nicole.
Hi.
My name is Dr. Mad. I'm going to do your cranial nerve exam. Go ahead and tell me your date of birth and your last name.
October 21st, 1998. My last name is Smith.
And what brings you in? Why do you want to do a cranial nerve exam?
I'm having some dizziness. I feel really loopy. And I've had like just weird sensations in my arm and my back. I'm like losing sensation of feeling in those areas, which really bothers me.
Okay. Well, you're definitely young, so that kind of problem is something that we need to take very serious and to investigate a little bit. For how long has this been going on?
About a month and a half, I would say like 6 or 7 weeks.
Have you noticed any loss of taste or smell?
No,
Are you taking any medications on a daily basis?
no,
Do you have any allergies to medications?
penicillin.
Are you having any pain?
No pain, no.
And how would you describe the loss of feeling? Do you feel any kind of pins or needles?
Sometimes it's normally like I'll touch an area and I just won't feel it.
Okay.
It won't register.
Numbness.
Yeah, it's a numbness sensation.
Okay. Have you noticed any blurry vision, double vision, any peripheral vision loss?
No,
Do you wear contacts?
I do.
When was your last eye checkup?
About 10 months ago.
Have you noticed any changes?
Nothing really, no.
Okay. Have you noticed any lumps or bumps anywhere on the body that I should check right away?
No.
Okay. I'm going to go ahead and put gloves on. I'm going to listen to your heart and lungs first. I can hear only S1 and S2, no S3, no S4. I'm going to listen to the bell for any murmurs. Can you take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay, good. Breathe in for me and strongly exhale. And again, breathe in and exhale. Okay, no crackles, no wheezing.
Okay.
I'm going to check your pulses as well. 2 plus. Synchronizing. Perfect. I'll take your blood pressure. Is this arm okay?
Mm-hmm.
I'm gonna have you uncross your legs, please. Blood pressure is a little bit elevated, 130/65. I'm going to go ahead and remove this. Let's go ahead and check your temperature. Any flu-like symptoms?
No, no.
Let's do it again because there's a lot of sound. Any flu-like symptoms?
No, no.
I'm going to put this under your tongue. Go ahead and hold it for me, please. Thank you. We'll measure your oxygenation as well. This will go on your left index finger. Okay, let's go ahead and check that. Thank you.
Thanks.
97.2. That's really normal. Perfect. Alright, so let's see. I'm going to check your reflexes first. I'm going to have you relax your lower jaw. Good. Go ahead and relax your arm for me. So leave all the weight on my hand. Perfect. Good. Okay. Relax. Perfect. Okay. Relax. Okay. Relax. Good. Okay. Alright, and relax your weight. That's great. Okay. Okay, diminish reflexes on both sides. We're gonna have to check your thyroid levels as well to make sure that it's not a hormonal imbalance. Okay. Alright. Let's go ahead and look inside your ears. You're just going to feel the tip of the otoscope inserting. Good. Tympanic membrane is perforated on both sides. We're going to check your optic nerve now. Perfect. So I'm going to have you look behind me straight at the wall. Try to keep your eyes open. Good. Okay. Perfect. I'm not seeing any lesions or anything like that, so that's
Okay.
very good.
Good.
I'm going to check your hearing now. Go ahead and tell me when you don't hear the sound anymore.
It's gone.
Go ahead and tell me when you don't hear it anymore.
It's gone.
Now, can you please tell me which position here is louder, position number 1 or 2?
Okay.
So this is 1 and 2.
2 is louder.
This is 1 and 2.
2 is louder.
Okay. I'm going to go behind you, and I'm going to need you to tell me when you don't feel the vibration anymore.
I don't feel it. I don't feel it.
Okay. We're going to check your taste now. So I'm going to put one paper on your tongue.
Okay.
Let's see. It's there. Alright, here we go. Go ahead and tell me what this tastes like.
tastes like a piece of paper.
Okay, so like it doesn't have any taste. Is that what you're saying?
It doesn't have any taste.
Alright. What about this one?
Oh, wow. That is like a very strong flavor.
Okay. Is it sweet, bitter, salty?
Bitter.
Bitter.
Yeah. Oh, not good.
I'm sorry.
It's okay.
Okay. What about this one? Alright, what does that taste like?
Sweet.
Sweet. Let's go ahead and try just one more. This will allow me to understand if there is any nerve damage on the upper spinal cord.
Oh, that is sour.
Sour.
Yeah.
Okay, so the results are normal, which is very reassuring. I'm going to go ahead and do a smell test as well. Okay, so first we're going to go ahead and check patency. I'm going to cover one nostril. Breathe in, breathe out. Alright. Breathe in, breathe out. Good. Okay, go ahead and cover one nostril for me. And I'll have you slowly breathe in and slowly breathe out. What does that taste like for you?
Some, like a tree, like maybe evergreen tree.
Okay. Let's go ahead and switch layers now. Thank you.
That one smells like a pasta sauce.
Okay. And now you can breathe in with both layers.
With both. That one smells like a lemon zest.
Lemon zest. Okay. Everything looks very good. I have no concerns there.
Okay.
I'm going to go ahead and lay down now. I will do your upper body sensitivity. I'm going to start by palpating your preauricular lymph nodes. And now I'm palpating postauricular lymph nodes to see if there is any swelling. Submental lymph nodes are right under your chin, so we're going to go ahead and check those as well. I mentioned earlier that we're going to check your thyroid gland, which is situated on the inferior side of your neck, right at the base. Usually it's non-palpable, and I should not be feeling any kind of lumps. Everything looks normal. Now I'm going to do a sensation test on the face. Can you go ahead and tell me if this feels sharp or dull?
Dull.
What about this one?
Sharp.
Okay, so we're going to continue with this test. Throughout the face, I'm going to touch you with these two textures. Tell me if you feel sharp or dull.
Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Sharp.
Okay. Now go ahead and tell me if you feel this cold or warm.
Cold.
What about now?
Oh, that's cold. That's really cold. Warm. Cold. Warm. 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 Cold. Cold. Warm. Warm. Cold.
Okay. Can you please tell me if this changes in intensity?
It stays the same.
And now?
It's the same.
Okay. Everything looks normal here. We're going to go ahead and focus on your scalp now. Go ahead and tell me if this feels cold or warm.
Warm. Cold. 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 Cold.
Okay. And does this feel sharp or dull?
Dull. Dull. Sharp. I can't really feel that. I think it's sharp.
Okay. Does this feel sharp all the way?
I could feel most of it being sharp.
Does this feel cold or warm?
I can't tell.
Okay. Does this feel dull?
I think it's dull.
Okay. Is this sharp or dull?
Dull.
What about now? What does it feel like?
Sharp.
And is this cold or warm?
I can't tell.
What about now?
Maybe warm? Dull? Dull.
Does this feel cold?
Doesn't really feel like anything.
What about now?
It's the same.
Does this feel cold or warm?
I can't tell.
And here?
Same, I can't tell.
So there's definitely something going on in that spot. I'm just going to do a few more tests here and then we'll move on to the arms and back. Does this feel sharp or dull?
Dull. Dull. I can't tell.
What about now? Does this feel sharp?
I think that's sharp. Yeah.
Does this feel sharp all the way?
No, not all the way.
Tell me when you don't feel the vibration anymore.
I never felt it. I can't feel anything.
Okay. So we're gonna go ahead and check your arms and your back now. I just want to make sure that there is that the nerve damage is localized.
Yeah, something is definitely going on.
Okay. So first, go ahead and tell me if you feel it on the left or right.
Right. Left. 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 Could you do it again? I think that was the left.
Okay. Now go ahead and tell me if you feel this wet or dry.
Wet. 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 Dry. 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 Wet. Wet.
Going to go ahead and listen to your lungs from the back. Take a deep breath in for me. And exhale. And again, breathe in. And breathe out. Okay, no fluid buildup. Can you please tell me if you feel 2 pressure points or 1?
Okay. One. 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 Two. Two. One. Two. One. Two. 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 One. One.
Okay, I'm going to go ahead and palpate your spine. I'm not feeling any deviation of the normal curvatures. Go ahead and tell me if you feel this on the left or right.
Left. Left. Right. Left. 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 Right. Left. Left. Right.
Go ahead and tell me if this feels sharp or dull.
Dull. Dull. I didn't feel anything. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Sharp. Dull. Dull. Dull.
Go ahead and tell me if you feel this vibration.
I feel it.
Tell me when it stops.
It stopped.
Tell me if you feel this.
Yes.
Tell me when it stops.
It stopped.
Same thing.
I feel it. It stopped.
Okay. Okay, we're going to order some more tests. I definitely want to do an MRI of the chest and the spine just to rule out anything that might be compressing the nerves.
Okay.
All right. I'm going to put your hair up. And I really want to take a look at the alignment of your spine. Okay, perfect. Let me know if you feel any kind of pain. I'm feeling some fibrous tissue here. That usually indicates some degree of inflammation. Normal angle of the cervical spine. Moving down to the thoracic area. Okay. There's Some bulging here at T1, T2. Increased space between T1, T2. We're looking for any bulging discs. I'm not feeling any signs of scoliosis or lordosis. I'm looking at the shape of the lumbar area. There is a slight curvature to the right. We're going to listen for any cracking sounds. So what I'm going to have you do is to slowly move your chin down, so kind of like touching your chest. Good. And slowly coming back up. And we're doing that again. Slowly going down. And coming back up. And again, slowly going down. Coming back up. One more time, slowly. Touch your chest one more time. And come back up. Okay. I'm going to take some measurements. We're checking for any signs of asymmetry. That's 56. 41. 'So that's about 15% degree of inflammation on the left side. I'm going to do a sensory test. So first we're going to check for vibrations. Can you please tell me when you don't feel this anymore?
No.
Okay.
No. No. No.
Okay, that was definitely a delayed response on the left side. Can you please tell me if you feel this cold or warm? Okay. Now I'm going to slide it down your back, starting with thoracic area, moving down to sacral. Go ahead and tell me if it changes in intensity.
Kind of felt numb in the middle of the back.
Okay.
I felt that all the way.
Okay. Now go ahead and tell me if you feel this on the left or right.
Right. Left. 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 Right. Right. Right.
Okay. I'm going to touch you with two textures. One is going to feel sharp. This is what sharp is going to feel like. And the other one is going to be dull. Okay.
Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Dull.
Okay. I'm going to go ahead and start by palpating scapulas. Sometimes a decreased mobility caused by fibrosis in this area could definitely lead to a lot of inflammation and pain. Okay, so what we want to do is to increase circulation in the area surrounding the spine and around the scapulas. I'm going to perform what's called skin pulling therapy. It's going to help to stimulate blood flow in that area and reduce some of the fluid built up. Let me know if you feel any kind of pain, but this should definitely not hurt. pain? I'm going to use this sensory brush to stimulate blood flow on all the area. It also helps to touch on the nerve endings and increase the threshold of the stimulus. We're slowly branching down, starting from the top, going on each vertebrae. And now trying to touch on the paraspinal muscles. anti-inflammatory oil. It also hydrates the skin, and it's very fast absorbing because of the cooling effect. It helps with lowering inflammation and pain. Okay, we're going to use a metal gua sha to scrape down on the neck muscles and kind of break some of that tissue that has been abnormally been building up. This is what is causing your neck tension and pain. There's a huge knot right here, so that's what I'm trying to break. This is gonna feel a little bit cold. Trying to do the same thing here, just covering more muscle mass, and it's really targeting the deeper muscles. go ahead and do some spinal adjustments and also work on your shoulders. Okay, I'm going to ask you to take a deep breath in. 1, 2, 3. Breathe out. Good. Perfect. And we'll do the same thing on the other side. All right, on the count of 3. 1, 2, 3. Take a deep breath in. Okay, very good. Okay. Looking at the alignment of the shoulders, there's definitely a decrease in inflammation on the left side, and we were able to target the muscles that are connecting to the thoracic spine. We did a shoulder realignment, and I'm definitely feeling some less fibrosis in this area. It was very stiff when we started. Yeah. Come on in. I'm going to apply pressure on both sides of your head. We're going to perform acupressure for headaches and migraines. Headaches are a body's warning signal that the brain may not be getting enough oxygen. So this palm press to the temples is accessing the gallbladder meridian. We're applying gentle pressure along the hairline and temples. Breathing in and out. Two seconds breathing in, 4 seconds breathing out. 1, 2, and breathe out. 1, 2, 3, 4. 1, 2, 3, 4. Good. We're going to use magnetic acupressure therapy. Going to apply one along the side of each temple. And now we're going to apply gentle pressure along the temples using a circular 360-degree motion. Now we're going to access the bladder meridian bamboo gathering or sanju. Wake up the base of the skull one hand, the thumb on one side, and fingertips on the other. We're pressing the upper ridge of the eye socket near the bridge of your nose with your thumb and middle finger, while the index finger gently touches between the eyebrows. And generally we do this for about 1 minute, breathing in and exhaling. Now we're going to access acupressure point ST3, which is right under your cheekbones, below the center of your eyes and parallel to the outer edges of your nostrils. ST3 is also clinically used for conjunctivitis, toothaches, pain, and swelling on the face. Okay, it's going to feel a little bit pointy, but we're doing the same thing, applying gentle pressure for a few seconds and releasing. We're also going to do ear seating, and we're going to apply gentle pressure on different points of the ear that correspond to main organs. If you feel any kind of pain, go ahead and let me know. Those are usually the points that we want to trigger. That means that your specific organ is struggling? Any pain here when I'm pressing down?
No.
Okay. What about here?
No.
Okay, what about here?
Yes.
Any pain here?
A little bit, yes.
Okay. We're moving towards the center of the ear. Any pressure here?
Yes.
Okay. These are the 3 points that we're going to activate. We're going to let the crystals apply gentle pressure. Go ahead and open the gown a little bit. I'm going to locate the shoulder well. I'm going to massage this point on both shoulders at the same time. Now we're going to locate wind pull or feng qi. It is based at the base of your skull. I'm going to feel for your ear muscle with each thumb and follow the grooves to where your neck muscles attach to the back of the skull. This is where we're going to apply pressure. Besides relieving neck pain, feng qi acupressure is also recommended when you have cold, flu symptoms, overall low energy or fatigue, migraine, or eye blurriness. I'm going to have you turn your head to the left. Going to apply gentle pressure and release. Move to the hands. Just gonna go ahead and close this way. Okay. Now we're going to find joining valley. It's located at the highest spot of the muscle. When you bring your thumb and index finger together, as you relax your fingers, I'm going to grip this point with my thumb and index finger. applying firm pressure and massaging it. This is clinically used for stress, facial pain, headaches, toothaches, and neck pain. Next, we're going to find triple energizer or triple warmer. It is located in the groove between the knuckles of your ring finger and little finger. So somewhere over here. Massaging this point helps relieve temporal headaches, but also shoulder and neck tension. Plus upper back pain. I'm going to apply a little bit stronger pressure here for about 2 minutes. To find a few other points now. Okay, next we're going to locate the Hall of Impression or Yin Tang. This point is located in the center of your forehead, right between your eyebrows. While you're sitting back in a comfortable position and you have your eyes closed, I'm going to use my index finger first to apply some gentle pressure. Make sure that we're locating this point properly. I'm going to use a circular motion to activate it. Now I'm going to find the governing vessel, Dumai, which is 100 meeting point or Poihui. It is located at the highest point of the crown of your head. Okay, to find it, I'm going to place a finger on the top of each ear, and then I'm going to run the fingers up the sides of your head until they meet at the top, and that's where we are locating the point. Just perfect. I'm going to gently massage. This point also helps to alleviate dizziness, clenched jaw, and of course headaches. Next, we're going to go ahead and locate the Great Abyss or Taiwan. I'm going to turn your hand palm up and slightly spread your fingers at the side of the wrist nearest the thumb. Here is an indent near the edge of the wrist. I'm going to gently massage this point in a slow circular motion for about a minute before repeating on the other wrist. Stimulating this point helps to relieve some physical signs of anxiety? Go ahead and relax your arm. Perfect. So I'm going to let you relax now and let me know when you're ready to get dressed.